With symptoms of chronic pelvic pain associated with the use of synthetic mesh bladder slings, women need to seek timely expert medical evaluation, may undergo potential surgeries, and must receive effective pain treatment. Dr. Hibner outlines what a new patient can expect upon arrival at their pelvic pain center.
Usually when they come in, they get a special protocol MRI that was developed by one of our radiologists to look for nerve injuries, to look for mesh, to look for anything that we are looking in those patients. After the MRI, they see my physical therapists, one of my physical therapists who does the very detailed exam of the pelvic floor muscles and takes the history. After the physical therapist sees the patient is then seen by our physiatrist. After the physiatrist, and sometimes this may take 2 days, it's not done in 1 day. And after the physiatrist, the patient is seen by my fellow, and then all the people that were involved that have seen the patient so far, we all meet in my office and we talk about the patient, we review the records, especially if this is a mesh patient who had mesh placement previously and then had mesh removals. We very, very carefully analyze their medical records, and we analyze what mesh was placed, what mesh was taken out. And then after we all discuss this case, I go and I see the patient with all this information that I have gathered from my team, and then I come in with some solution for the patient.
In choosing the right healthcare provider, women are treated by multiple specialists. That treatment often includes surgical removal of the mesh device, reconstructive procedures to treat ongoing incontinence, treatment of chronic pelvic pain that leads to physical disabilities, and psychological support for depression.
Our practice is dedicated 100% to women with chronic pelvic pain. So we see all female patients with chronic pelvic pain regardless of what the reason for pain is. So each patient is treated individually depending on what was the reason for pain or what happened when the pain started. And again, it's not only about removing mesh, because that part actually is technically not that difficult to remove the mesh. It is to take care of all the other reasons that surround the pain in patients with mesh, like CRPS, like nerve injury, like muscle spasm.